Between the 3rd and 9th week of pregnancy, the head and the face of the fetus begins to take shape. This is a very crucial time, yet it's during these early days that many women do not know that they're expecting. Some birth defects occur during this period. When this woman was expecting, she looked forward to having a healthy child. However, she gave birth to a baby with a cleft lip.
So the child is born with the lip incomplete, so there's a gap between the two parts of the lip and also the palate as well.
She accepted her child the way he was, but that wasn't the case with everyone around her. We met this mother seeking treatment for her child's condition at Kosi Rehabilitation Hospital after she learned from a nurse at her local health center that a cleft can be corrected.
So this is a right-sided cleft lip, and the palate is not cleft, yeah? So it's just the right-sided cleft lip, and generally these babies will be able to breastfeed well.
Dr. George William Galiwango is a plastic surgeon at Kosi Rehabilitation Hospital. His day-to-day work involves doing corrective surgeries on children and sometimes adults with clefts.
Many mothers are shocked when their child is seen for the first time and they have a cleft. And then they struggle sometimes. Some of these children can't feed well, especially when they have a cleft palate. So the stigma starts right then. And in many communities, especially in northern Uganda, they have special names like Ojok, Ajok.
The exact causes of a cleft remain a mystery, but medical experts agree on certain risk factors which could increase one's chance of having a child with this condition. These include genetic predisposition, drug and alcohol use, smoking, maternal illness, infections, and lack of vitamin B folic acid. A woman is at a higher risk of having a baby with a cleft if she is a teenager or over 35 years old and is exposed to agents of malformation of an embryo, which include medications, chemicals, infectious diseases, and environmental agents that can disrupt the normal development of a fetus. Clefts are both mild and severe.
This first one is only on the left side. That is the same left side but also includes the front part of the palate. This is left side including the palate, and that is bilateral, both sides, left and right, including the palate. But these children will actually have teething problems. Their teeth are not aligned well.
Usually, some mothers may not notice a child has a cleft until much later, especially when it is in the palate, hidden far in the roof of the mouth, and is not visible from the outside.
The mother might perhaps tell if the child is not suckling strongly enough.
It is estimated that one child in every 100,000 live births in Uganda is born with a cleft abnormality. A cleft can be rectified with a simple corrective surgery, yet there are many primordial myths that stop families from seeking treatment for their children. Mama Auma hails from Bujiri. She came to Kosi Rehabilitation Hospital earlier this week to correct her child's lip and palate cleft. This baby has been undergoing nutritional rehabilitation for the past few months as a prerequisite before surgery can be carried out.
They need a particular weight before they can undergo surgery. Okay? But because they have feeding challenges and difficulties, they're not like other children. That's why they bring them to nutrition, for us to help them attain their target weight.
Usually, children with clefts find difficulty latching on the mother's breast to suckle, something that makes breastfeeding in the first 6 months a challenge. Baby Jovia stopped breastfeeding at 2 months.
The surgeons need 5 kilograms at 3 months, at least 3 months, at least 5 kilograms at 3 months. Then they can start negotiating surgery. How do we help them achieve it? When they come, we first of all assess the mother and the type of cleft. If the child has only a cleft lip and the palate is intact, usually they are able to latch on and they can suckle. Though the mothers may not know this. So usually if a mother comes in with a child, it's day 0 or the first day or 2 days when the breast milk has just come. There we show them how to latch on, how should the child latch on, how onto the breast, how should they position the baby as they are breastfeeding.
There is a need for midwives to train mothers who deliver children with cleft, basic feeding guidelines that can help their children benefit from breast milk.
So at birth, you usually have the midwife, pediatrician, and plastic surgeon talking to the mother. Psychologists will come in, counselors. They talk to the mother and the parents and and the doctors discuss. And then at the surgery, many times it's just the plastic surgeon performing the surgery. And then after that, you might have the orthodontist coming in, speech therapist as the child is growing.
We met baby Jovia a day after her successful surgery.
Nti omwana wange okuva emabega eri yavadde nga nakimwe kati saawa zino ali bulungi kati.
At Kosu, Chibuli, Mulago hospitals, among other facilities, one can now access free cleft surgery. Dr. Galiwango says this hospital undertakes about 200 surgeries a year. However, there is a backlog of adults with clefts unattended.
Don't know the repair can be done. They live their life, they got teased and all that. Some of them have children.
In adults, cleft repairs are much easier as a surgeon deals with a less dramatic patient.
Aspects that might not have a better outcome is the palate repair in an adult. They might not learn to speak well, which is why we prefer to do the palate repairs in children under a year.
At the end of a successful cleft repair, one can only appreciate the transformation that will certainly bring a smile on many faces. Gertrude Tumusiime Uwitware, NTV.